Okay, good morning.
Good morning.
We have your legal permission to publish this on the internet, and we're going to use it for a reality show, Comedy Central, and so do you have your permission to use this in return for the iPod for you to be on the video? Okay, thank you. So do you want to introduce yourself and just use your first name?
My name's Crystal from Nevada.
Somewhere in Nevada.
Somewhere in Nevada.
Could be Reno.
That's right.
Could be Searchlight. We just don't know. And you are special because when you had surgery, you were diabetic.
Yes.
Can you talk a little bit? Do you mind talking a little bit about your diabetes for patients who had diabetes?
It was out of control. I go to Dr. Well, I don't want to say his name, but he was gonna. Yeah, I've been a diabetic 15, 18 years. I'm on 5 different medications for high blood pressure, 2 for diabetes.
Can you mention them? Do you mind?
Well, I'm
Remember
really
you got
bad
taken
at
off the Byetta?
Yeah, I got taken off Byetta. They put me on some weird pill that no one ever heard of. The pharmacist
just got approved. Yeah.
Yeah, and my sugar's running
glucophage and metformin. I'm sure.
Yes. Yeah. And I was told I was going to go on insulin if I didn't do something. My sugar's always been yes.
You better do something. I'm going to put you on.
The only reason I'm not on insulin is because he heard I was doing this.
Right.
So he said, "Well, we'll see what happens."
Right.
Because they've been 300, where I've never had a problem with my sugars. They've been pretty level.
Right.
And in June, he doesn't know what happened, but I think it's the Byetta he took me off of. They went out of control, and they've been out of control ever since.
Right.
So I went and had this done. Right now, this morning it was 167.
Pardon me?
167.
I can't hear you.
I did take one pill, but not any of the others because they've been running about 250 to 200, 250.
Right.
But I wanted to talk to you about that because I'm wondering if a lot of it's the Gatorade, all the sugar.
No.
Oh.
No.
Okay.
So stop taking your medicine, and diabetes is going to go away.
Okay.
Yeah. Remember, I think we talked about this last week, but we just did a survey.
Huh?
Have faith.
Yeah.
We just did a survey, and 93% of our diabetics are cured of their diabetes, taking no medicine. So, yeah.
I definitely feel a change though, because usually I'm cloudy, my head from the sugars, and they say it's from the thick blood from being diabetic, and I definitely feel a difference with that. I don't have that heaviness.
Okay. And you weighed yourself?
Yes, 5 pounds.
Good.
Yeah. But from the night before, it's really 11 pounds. But that put me on that laxative the night before.
All right.
Yeah, so if I went from the night before, it's really 11 pounds.
Well, that's how we actually get our weight losses, by giving people...
I know! The next day I was a lot lighter.
All right.
Yeah.
It's a trick.
Yeah.
The surgery makes no difference at all.
No.
The mag
It's the laxative.
That's really effective.
But my blood pressure's been pretty good.
What's that?
It's been running from 111 to sometimes it was like 125, but in the hospital it never went above 111.
And are you taking your blood pressure medicine?
I had me take a half of one,
Right.
and then I took a half of one last night because it was at 129. 129.
So I'd probably skip a night.
Yeah, I did. In the hospital I didn't take it at all.
I know.
Yeah, so.
We'll try to work off that atenolol.
Yes.
Good, okay.
Yes. But I feel great. I didn't have any pain,
Good.
no nausea.
Right.
The only time I had nausea, I did it to myself, and that was in the hospital. I gulped water because I was really thirsty after surgery.
Right.
You're right. When you feel that pain,
Stop.
oh, that was the worst. Yeah. But the surgery was great. 30 minutes and. Oh, I tried watermelon.
Yep.
And I did throw that up. That was the only thing I threw up. You did too? Yeah.
Now watermelon does terrific. You're just taking a little too much too fast.
Yeah.
In other words, people say, "Oh my goodness, I can't drink Gatorade. It makes me throw up." I go, "It's too much too fast." Because Gatorade works fine. Here's the thing: you're used to doing this and drinking. Now it's sip, 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 sip. Go slow.
I've always been a gulper. I always drink really fast. So that's the hardest thing for me is sipping all day long. Yeah.
And I can guarantee you're going to stop doing that.
After that one time, I did. That hurt.
Is that right, John?
Ooh,
Yeah,
hold on.
yeah.
Should we tell your story? Do you want to tell your story? Go ahead. Now, you know that I don't want to misquote you. So,
On which one?
well,
The
John.
lamb, isn't it the lamb he had?
John has had a couple of times
Yeah.
where he has tried to. They say, don't spit in the wind,
No, don't
don't
do that.
pull on Superman's cape,
Mhm.
and don't try and go against the MGB.
Yeah.
So you
won't win.
had two experiences, right?
Yeah.
One was lamb.
One was lamb. That was a little early. In actually just this last weekend, the church had a brunch, and perhaps I might have just overindulged a little bit. So we needed to pull over the side of the road.
Ugh.
What? Now you're 3 weeks out.
I'm 3
And
weeks
what did you
out.
eat at the brunch?
I had a little sausage.
No, not at 3
Yes,
weeks.
I could.
You can't have sausage. You can't have sausage in 3 weeks.
Take me.
Sausage, just put this on the tape. No sausage in 3
I don't
weeks.
know if I want to videotape him again. Eating sausage.
No, you're educational for our
I
patients.
am.
It's okay to have sausage if you want to throw up.
And I had a deviled egg. And,
No deviled eggs. at 3 weeks.
and I had a deviled egg.
Now you could have a bite of a deviled egg.
Well, and what I'm finding is I'm hard-boiling eggs, and I'm eating the whites, and I'm not having a problem. It seems like the yolks right now I'm having a little problem
It's
with
the
yolks.
amount, not the.
How bizarre.
It's not the amount though. It's the. I'm sorry. It's not the type, whether it's white or yolk. It's the amount.
Okay.
And again, tiny bite. Do nothing for a while.
Yeah, and I'm having one scrambled egg for breakfast, and that's enough. No toast, no nothing else.
And again, that's
scrambled.
okay. Slow.
Yeah.
One
yeah.
scrambled egg fast, big trouble.
Big trouble.
One scrambled egg over a half an hour with pauses in between bites.
Yeah. It absolutely is a large learning curve.
I actually bought a baby spoon.
And you know
Yeah.
what? And we're eating on smaller plates, and I love to eat. I did. That was a hobby that I mastered. Some people build models. I could sit down and eat a half a gallon of ice cream and not think twice about it. I mean, that's me. But I'm really working hard on it, and it's a hard change. I'm telling you, it's a hard change.
See, I'm finding it hard to remember to eat
Well,
because I'm never hungry.
Here's the thing. Now, people say, "Oh, I must eat." You do not have to eat. Don't
Okay.
force yourself to eat. You do not have to eat. This is what I say. Look down. All of us look down.
Right,
Right. We can miss a meal.
right.
Don't worry. You don't have to eat. People, and like I forget who was saying it. I have to eat protein, to get my strength back. No, you're full of protein. You're up to your aspirations in protein.
Okay.
Yeah.
So as long as we're like drinking the Gatorade,
All you need is a little bit of salt water, and in a week or two, you need a few vitamins.
okay.
But you do not need any protein. People are like driven. America is protein driven.
Yeah.
On my mailing list, people are like, I need some protein. How do you get protein? Tell me what your tricks are for getting in protein. I found a protein shooter. Tell me where you scored your protein shooter man. There you scored. Yeah, right. To go, you're full of protein. And now for the rest of your life, a little bit of extra protein. But you don't need any protein now.
Okay.
Yeah. You don't need to remember to eat.
Okay.
Forget it.
And I found that the first week too.
Yeah.
But I think it was more, I had to have something in my hand. And now, to be honest with you, I don't even think about it.
No.
Well, yeah, but I was at a stoplight yesterday, and I'm like, there's food things everywhere around.
Everywhere.
And I'm just like, oh my gosh.
Yeah.
Did that? Wait. Did that bother you?
Well, I didn't, except for yesterday. It was the first day I was a little bit hungry. Like not hungry, but just needed something besides the chicken noodle broth.
Well, here's what I was going to say. Sometimes in our female patients, when they say they start craving or bothers them when they see a commercial and they can't eat, they glow estrogen and maybe the estrogen patch.
Well, my husband says I need that.
Because you
Is that pre-surgery or?
Yeah.
well, and let's talk about that. Remember again that if you're a heavy woman, your estrogen is abnormally high, and the surgery drops it down to normal. that's great for long-term risk of breast cancer and things like that. But it's a lot like quitting smoking. Quitting smoking is good for you, but it can be deadly as far as your emotions if you quit smoking and you're angry and grumpy and annoyed. And when we drop your estrogen, a lot of times it's like going through menopause. You can be grumpy and angry and irritable and things like that. And just the estrogen patch, like a nicotine patch, can help get you through that couple of weeks as you adjust. So if your husband's seeing it, it's often the case. Just a thought. It'll make your life a lot better to have a couple of weeks of the patch.
Okay.
What have you been eating? What have you been?
I've been eating soup, V8, Gatorade. I did have a little bit of asparagus that I chewed really well. I had a little bit of creamy mashed potato. No meat. I haven't even attempted any.
Not in the first week.
No.
Bad idea.
What else? Crackers. A lot of crackers. I eat a lot of saltine crackers.
Saltine crackers, very good.
Yeah,
choice.
and applesauce.
Applesauce? Okay.
Yeah.
Everything's okay. Small bites.
Yeah.
Very slowly and very well chewed.
And I did. I bought baby utensil.
Good
Yeah.
choice. Did you think about anything before the surgery? Think about having a lap band or?
I was thinking about the lap band and the RNY.
Right.
My assistant had the RNY about 7 weeks ago, but she's over 400 pounds.
Right.
So she did really well. I was going to have the lap band. I went with a friend of mine to Costco, and we were talking about it, and a lady came running up to me telling me, don't get it, don't get it, don't get it. She had it done. She lifted her shirt, had me feel her stomach. Said it's the worst thing she ever did. So I totally got that out of my mind.
So that lady I paid at Costco is working out.
I think you did. I thought the RNY was really risky.
Kind of more radical.
Yeah. So my doctor's nurse had this done. And she's the one who talked to me about this. She's absolutely beautiful and loves it.
Yeah.
She had no problem except an iron deficiency,
Right.
which she took care of, but she looks beautiful. And she's very, very happy.
Yeah, we're going to try and have her wear a little badge.
You should. She's all for this. All she does is talk about it.
Yeah.
And she has no problem telling anyone how much she lost, how much she weighed. She looks great. And she's a young girl. So I wish I would have done this 25 years ago.
Any questions from the new folks about her surgery or anything?
No pain after surgery. I had 0.
Your blood pressure, you said it's 21 a night. What does that mean?
120. It was. I was on 2 blood pressure pills. Now it's running like 111 over 65, 70.
That's pretty low.
Yeah.
That's good.
Yeah. And I was taking a blood pressure pill in the morning and one at night. So now it's kind of a hit and miss if I even take one.
So even when your blood pressure was high, it was only in the 120s?
No. That's the highest it's gotten since I've had surgery. Yeah. It was in the 130s high. Yeah.
Thank you very much. Here's
right.
your iPod. Applause. That's rough. See, now you know what a hard job I had.